So you've had a diverticulitis flare-up and you're finally feeling better, but now you've got some pain in your joints, maybe some inflammation, somewhere in your body, and you're thinking about taking anti-inflammatory. So here's what a lot of people don't seem to realize or appreciate. Maybe the doctor never told you, but taking NSAIDs, which stands for Nonsteroidal Anti-Inflammatory Drugs, like ibuprofen or Advil, naproxen, or even aspirin, increases your risk of another diverticulitis flare-up catastrophically. We're talking about nearly 7 times higher risk of bleeding and a 3 times higher risk of perforation. It's like playing Russian roulette with your gut. Every time you take it, you are dramatically increasing the odds of another flare-up, another ER visit, another round of antibiotics that decimates your microbiome and the resilience of your gut even further. So in this video, I'm going to walk you through exactly what the research shows about NSAIDs and diverticulitis, why they can be dangerous, and what pain relievers you should consider instead. Now, obviously, don't change anything you do without speaking with your doctor first, but it pays to be well informed and to get educated on this, which is the purpose of this video. Now, just to quickly intro myself, my name is Joe Leach. I'm a qualified dietitian and I run Diet vs. Disease. It's one of the world's largest online gut health clinics. We've helped over 15,000 people rebuild their digestive health, and diverticulitis recovery is something that we specialize in. And if you are already a subscriber to the channel, welcome back. All right, let's get stuck in. The numbers don't lie. Let me show you some numbers that influence how we talk about pain management with our diverticulitis clients. So first is the risk of getting diverticulitis in the first place. This study followed 47,000 men for 22 years. They found that people who regularly take NSAIDs have a 72% higher risk of developing diverticulitis. Now, not only that, the risk of complicated diverticulitis, that means perforation, abscesses, the serious situations that land you in the hospital or needing surgery, those more than doubled. And the longer the use, the higher the risk. After 10 years of regular NSAID use, the risk jumped up even more, 80% increased risk of diverticulitis. Now, we've spoken with a lot of people who are 60 years and older, and many of them say they used to pop ibuprofen on the regular when they were younger, like it was candy or something. And they believe that contributed greatly to their issues today. Second, the risk if you already have diverticulitis. So this is where the numbers get even more concerning. This analysis looked at 13 previous studies on people who already have diverticulitis. If they take NSAIDs, that's ibuprofen, naproxen, diclofenac, their risk of diverticular bleeding increases by 7 times. Not double, not triple, nearly 7 times higher risk. And for complicated diverticulitis, the odds ratio was 3.13, which suggests more than triple the risk of serious complications, basically. Now, I don't want to bore you with more research, so this is the last one, but if you've already had diverticular bleeding, this study followed patients for a year after their episode. Among those who stopped taking NSAIDs, only 9% had another bleeding episode. Among those who continued taking them, 77% had recurrent bleeding. So stopping NSAIDs reduced the risk of recurrence by 94%, numbers that you can't really ignore. Why NSAIDs can harm the gut. So what's going on here? Why can NSAIDs be dangerous for your colon, your large intestine? Well, the first thing is they break down your gut's protective lining. So think of your intestinal lining like the walls of your house. NSAIDs essentially remove the protective sealant and the weather durable paint that keeps everything like watertight. So in the intestine, they thin out the protective mucus layer, making it easier for bad bacteria to get through. In diverticulitis, you've already got these small pouches in your large intestine that are vulnerable spots, right? So when NSAIDs weaken your defenses, bacteria can invade those pouches much more easily. And that's when you get inflammation, infection, and potentially an abscess or perforation. The second thing is they reduce blood flow to your intestinal lining. So less blood flow means less oxygen, fewer nutrients getting to the tissue, and a reduced ability to heal. So less resilience, right? Your gut becomes more fragile and more prone to injury. And the third is they prevent blood clotting. Now, this is why the bleeding risk is so high, because they thin your blood. So when a small blood vessel breaks in your colon, which can happen in diverticular disease, it can't seal itself up like it normally would, and the bleeding continues and gets worse. Now, NSAIDs are just one piece of the puzzle when it comes to preventing another flare-up. The other big piece, your diet. And there's a lot of confusing, contradictory, and frankly outdated advice out there about what you should and shouldn't be eating, right? And that's why I created a free guide that cuts through all the noise to give you clarity and what you need to feel confident about your choices. So you can download it in the second link in the description, or just comment guide below and we'll send it straight to you. What should you take instead? All right, so NSAIDs are out. What can you actually take for pain then? Option 1 is Tylenol or acetaminophen. This is the standard recommendation in clinical guidelines. And for most people with diverticulitis, it's the safest option. The key is the dose, of course. As I always say in my videos, even when we talk about food and nutrition, it's the dose that makes the poison, right? So guidelines say to keep it under 2,000 milligrams per day. Above that increases your risk, not just for your gut, but also your liver. Option 2 is aspirin. And that's complicated. This is where things get nuanced because aspirin is an NSAID too, but it works differently than ibuprofen, for example. Now, the study I showed you earlier, they also looked at the effects of aspirin and concluded that regular aspirin use increased diverticulitis risk by 25% and bleeding risk by 70%. So that's lower than non-aspirin NSAIDs like ibuprofen, but it's still significant, of course. Now, why this is nuanced is because if you're taking aspirin because you've already had a heart attack or stroke, what doctors call secondary prevention, most experts agree the cardiovascular benefits outweigh the diverticulitis risks. So it makes sense to continue the aspirin in that instance. But if you're taking aspirin just for general heart health without a history of heart problems, that's primary prevention, then the calculation is different. The bleeding risks may outweigh the benefits, especially if you have diverticular disease. So that's something to consider. Of course, you should never change any of your medication without speaking to your doctor first. I'm not telling you what to do. I'm just a guy on the internet after all, right? I'm just presenting the data and the guidelines as we have it for you. What this means for you, as far as research goes, the findings are profound. Regular NSAID use more than doubles your risk of complicated diverticulitis and increases bleeding risk nearly 7-fold. So what should you do? Check your medicine cabinet. Make sure you understand what you're taking. Tylenol appears much safer for pain relief. Data indicates to keep it under 2,000 milligrams per day to not increase GI risks. Some sources say you can go higher than that. You have to speak to your doctor. If you're on aspirin, talk to your doctor. Don't just stop if it was prescribed for your heart, but have an honest conversation about the risks and whether it's still the right choice for you. Again, of course, this is general education based on what the research shows. Your specific situation may be different, especially if you have cardiovascular disease or other conditions. So always speak to your doctor. And if you are feeling overwhelmed with all the recommendations and trying to figure out how to manage diverticulitis, especially with like what to eat, what supplements you can and can't use, what meds may have implications, that's completely normal. Most of our clients come to us after trying to piece this information together from, Google searches and YouTube and contradictory advice they come across. They've wasted a lot of time, they've had setbacks, and they're worried about another flare-up. And that's why we created the For Sure pathway. So we do some testing to find out if anything else is going on with your gut and food intolerance, not just like guess based on symptoms. We create a personalized plan based on what we see. We support you through the entire healing process and help you reintroduce foods systematically so you know exactly what you can and can't tolerate and minimize your risk of further episodes. So if you want to learn more about working directly with us, click the first link in the description to learn more. And if you'd like a written guide about what you can and can't eat, debunking the confusing misinformation that's really rampant online, we've got a free diverticulitis resource for you to use. That's the second link in the description. Or you can comment guide and we'll send that guide to you. I hope this was helpful. If we missed anything, let me know in the comments. Be sure to give the video a like and subscribe to the channel for more videos like this one. And if you want to learn more about the details of our one-to-one process and how it may help you, then I recommend you watch this next video.